Folks in New York are understandably upset, calling for even greater transparency, and some are primarily angry about the loss of their loved ones and demanding accountability. Well, that includes Fox News senior meteorologist Janice Dean, who tragically lost both of her in-laws to COVID-19 in New York assisted living facilities. She tweeted that Governor Cuomo's statement that incompetent government kills people, quote, is right. Too bad he doesn't realize he's talking about himself. So let's discuss it with Republican New York Assembly member for Westchester, Kevin Byrne, and Janice Dean herself. Great to have you both with us. Thank you.
Thank you, Shannon.
So the New York Times says this about the report today. In the 76-page report released on Thursday by the Attorney General, Letitia James, a survey of nursing homes found consistent discrepancies between deaths reported to the Attorney General's investigators and those reported to and officially released by the Health Department. Janice, I'm not sure you knew much about whether this report or when it was coming. Do you feel in any way that all of your months of calling for this information has been some measure of justice today?
I think so. I mean, there was surprise because all of these months we were asking for accountability. Assemblyman Byrne, by the way, who is with you tonight, has been with me by my side from the very beginning. So I thank him. He has been one of the most wonderful lawmakers to work with that really cares about the people he represents in New York. And, you know, some people could take a few lessons from Assemblyman Byrne. So to answer your question, I think there was some relief that maybe someone was looking out for us and someone was trying to hold the governor accountable.
So Dr. Howard Zucker, the New York State Health Commissioner, has put out a lengthy rebuttal to the claims today. He says this in first talking about the total deaths. He says the report is clear. There was no undercount of the death toll. It affirms that the total number of deaths in hospitals and nursing homes is full and accurate. But Assemblyman, that's not the issue. That's not what this report was about.
That's correct. And Shannon, I happen to serve as the ranking member of the lead Republican on the Assembly Health Committee. And so this is something we've been seeking for a very long time through legislative hearings, forums. We've written to the CDC, President Trump, President Biden, trying to get this information for a very long time. And the commissioner is now trying to really equate the total number of all death in New York State to be the issue. And that's not what we're talking about here. We're talking about the devastation that happened in our nursing homes and how they, for months, refused to give us the complete number so we can measure how our state did. You know, what did we do right? What did we do wrong? We know there was a highly controversial directive on March 25th that essentially forced COVID-positive patients into nursing homes. How are we supposed to measure that and actually have a real, candid conversation and create better policy and talk about investigations if you won't even give us the public data? Finally, they released something today, but we got more work to do.
Mm-hmm. Okay, you mentioned that, and Dr. Howard Zucker also responds and talks about that memo. And Janice, you've pointed to this memo many times as something we need more information about exactly what happened. Now, Zucker's statement says the OAG, meaning the Attorney General report, also found no evidence that DOH or the Health Department's March 25th advisory memo resulted in additional fatalities in nursing homes. Janice, I'd like to get you and the Assemblyman to both comment on that. I mean, the memo is what it is.
March 25th, there for 46 days, the governor mandated that COVID-positive patients be put into nursing homes, and he himself said it would be like wildfire through dry grass. He knew the risks that were associated with that, and he has blamed everybody else and everything else except the person that signed that mandate. So there are still questions to be asked and still answers to be had, and maybe this is just the beginning of something a little bit bigger.